Hi, this is Terry Kuti again, and I'm sitting on a chair. I'm a little bit lower than my physical therapist, Leslie Drawdy, who is a certified lymphedema therapist. We're continuing our discussion about lymphedema as it refers to breast cancer surgery, mastectomy, or deep flap, or any other type of breast reconstruction, implant-based. So I'm going to have Leslie talk to us today. I really kind of want you to show our viewers with this chart here where the lymphatic system is. Let's start with the top, Leslie, in terms of what areas are affected during breast surgery or any type of breast reconstruction.
Okay, well, all up in here, we have all kinds of lymph vessels. I don't know if you guys can see the little green lines in this picture, but those are depicting the lymph vessels in the body. These are deeper. You actually have lymph vessels and lymph nodes all over your body, spread out in various regions. But for breast surgeries, primarily we're looking at your major lymph node centers in the upper body, in the armpit, the axillary region. I think most of you are probably aware of that. There's usually often clusters of lymph nodes right along your sternum, and then right above your collarbone at the base of your neck. Those are really the major centers. And then we also have some deep lymph nodes in your abdominal region, and those also can be affected from the breast surgeries. Do you want me to go ahead and talk about the other reconstructions as well, or?
I do, but I have a quick question for you. So you use two terms, lymph vessels and lymph nodes.
Yes.
Can you tell us a little bit about the difference in those two?
Well, your lymph nodes, I mean, everyone's heard of lymph nodes. When we say our glands are swollen, we're talking about lymph nodes. And lymph nodes are part of the lymphatic system. They make immune cells. So when you're sick, they're the ones that make those little white blood cells that go and eat up junk. Okay, so.
And help drain it out.
Help drain the body. So the lymphs, all those lymph nodes are connected to lymph vessels, and lymph vessels are all over the body. Like I said before, they're kind of like the drainage ditch system of the body. So here's my little blue jeans analogy. This is what I tell my patients. We all know how blood circulates through the body, right? Arteries, veins, heart, it moves through that system. It's a system under pressure, kind of like when you turn on the faucet at the kitchen sink. Water is pumped through the pipes through pressure, right? The fluid's being pushed through. The lymph vessels work a little differently, but they're kind of all over the place. So they're not the main river that, you know, the water of your blood is. They kind of collect all of the waste fluid from all your cells doing what they do and making garbage, and they take it away to the sewer system. And they run a little slower, so they work more like sucking a milkshake up through a straw. You have to suck the air out of the straw first before you can get that thick milkshake up, and that's how the lymph vessels work. A little bit tangential, sorry for that, but
I like that description.
I do too, because it's very concrete, down to earth, very blue jeans, and it makes sense in my brain, so I hope it makes sense in yours as well.
Made sense in mine, and I got to tell you, we're making this video at the end of the day.
End of the day.
Yeah, so it worked for me. So I came in, we're in this office setting right now with Leslie, and you did my physical therapy after my mastectomy, but then 7 months later, I had deep flap breast reconstruction.
Yes.
Can you tell us about the lower extremities? Because there was a Facebook Live tonight that I watched from Dr. Ramon Garza at PRMA in San Antonio. They do a procedure that's LVA, which is lymphatic
venous
anastomosis. So that is the connection. The anastomosis is the connection of those tiny lymphatic vessels under those high-powered microscopes. And then there's also lymph node transfer. That all is affected, or the lower extremities are affected there. Can you show us that on the chart too, Leslie?
Sure, and I think Dr. Garza mentioned that, you know, he was talking about risks. I caught just a little bit of his cast. Talking about risks and donor sites for harvesting the lymph nodes that would be transferred. So one of those potential sites is what they call the inguinal nodes. So right in your groin, you have another major lymph node center or cluster. And so this is one region where the surgeon may opt to take a lymph node from here or a couple of lymph nodes from this area and then transplant them up into the armpit region.
Okay.
So your risk for that is you could potentially develop then lymphedema in your leg.
Okay.
It's possible.
So let me ask you this question. I'm thinking about this in terms of just the deep surgery, and I didn't have the lymph node transfer, the LNT. Is it possible, just because of the disruption in that area, for, say, a deep flap patient to experience any lymphedema, even if they didn't have, LNT, the lymph node transfer?
It is. And we could go a little bit deeper into that, but a lot of times what I see after any reconstructive procedure, but with the deep flap, at least when you and I were working together, is, of course, it's a major surgical procedure.
Right.
And there is a lot of swelling that has to be managed.
Yes.
And there's some scars that need to heal.
Yes.
And that's all, with any surgery. But with that in particular, you're talking about surgical incisions in very soft areas.
Okay.
And you can have what I like to call lymphatic backup. So it's not necessarily that you're developing lymphedema, but you've got lymphatic backup because you've been cut into, now you're healing, now there's scar tissue, now we need to mobilize the scar tissue so it doesn't trap lymph fluid.
So that's the video we're going to do a little demo, and that's why you showed me how to do some lymphatic drainage in the groin. Let's do that on the next video.
Okay.
Thanks again, Leslie.